Hello, everyone. I'm Elliot Davis. I am the policy analyst for the HIV, STI, and Viral Hep Bureau at the Houston Health Department, longest title ever. And I am the one responsible for uh, kicking this whole town hall initiative off. And this is actually to give you guys a little history, if anyone's new to this effort. These are something we started in response to our syphilis outbreak, and they have been so popular that we have decided to continue them. And so, if anyone's joining us for the first time, you're catching us as we're starting to kind of turn from that syphilis focus to more general bureau work. And that's where you find us today. So, I've actually been working on this as a brainchild since last year, before our last town hall. And what I really wanted to do, I set off with two objectives. I wanted to kind of do a level set and really get an overview of our services, not just what we offer, but how we offer it out to the community, especially given that we've kind of attracted a novel audience with these town halls, especially where community leaders are concerned. And my other objective was I really wanted to provide an opportunity for the community to get to discuss opportunities, especially around partnership, because I noticed not only we have a lot of community partners involved, but we have a lot of public health partners from surrounding areas. So that's kind of where the impetus of this came from. And then over the past few days, I also realized I have a third ulterior motive and objective, and that in the wake of all this uncertainty, where not just policy, but especially public health policy is concerned, I really wanted us to have an opportunity to highlight the value of public health and the work we do in general. So that's kind of where you find us. And with that, I'm going to dive right into it. I am going to go pretty quick through some of these slides, but I'm going to provide them to everybody. This is really going to be a high level, just trying to kind of give you an idea of what the landscape looks like. So while I've got some data heavy slides, I'm going to keep a high focus on really what I'm trying to get across here, and that's the amount of work there is for us to do, right? So this is a quick map of HIV rates from 2022. It's the most recent data we've got from the CDC. And just from this picture, know that the darker the color of the state, the higher the rate. And so you see Texas down there, along with our partners in the South, at well above what is considered the national rate of about 13 per 100,000. And everything we talk about today is going to be in terms of rate. So, controlling for population. And similarly, what that map was also alluding to, but what's clear here is that the South has a disproportionate burden of HIV diagnosis. So over 50% are attributed to those states that at least the CDC considers the South. You see in purple there. And so Texas has its work cut out for them where HIV is concerned. But here in Houston, Harris County, that's magnified even further. So you see on the left here, the new diagnosis rates for 2022, and Houston Harris County is well above double. Same thing with folks living with HIV. We're far above the national average. And so that's what led, it was actually President Trump during his first administration to establish the national goal of ending the HIV epidemic, or what we like to call EHE around here. It's specifically focused on, there are 48 counties that you see in the dark blue there that account for more than 50% of the diagnosis. So you see our Harris County down there along the coast, and a few other territories, and there are 7 other states with a high burden. And two things that this slide's telling you, that's one thing we all know, which is Houston or Harris County is large. And then the other thing you see here that's kind of inlaid, and don't worry about digesting this right now. We're going to talk about this more in application. But you're not going to only hear from me about what the Houston Health Department does. You're going to hear from some fabulous partners that we work with. While we're funded for certain elements of STI and HIV, we have partners at the county, partners with the resource group that are funded to do the complementary services that all come together to provide, from the community member standpoint, the whole gamut of services. And one more slide I'd like to include. This is what we call our care continuum, and it shows 2020 to 2022. This is a quick visual of what we're trying to achieve, which is the ultimate goal of getting someone that has been diagnosed with HIV to viral suppression. Because again, if we can get that person to where they're undetectable, it's that we call it U equals U. If they're undetectable, they're not transmitting. And so I talk a lot about HIV. That's because that's not only what a lot of our work goes towards, and a lot of our funding is um, uh, uh, granted towards grant objectives and otherwise. But it's also what our partners that you're going to hear from. It's what they do. The majority of their work is HIV based. Now that said, we still have a whole other area that we're responsible for, and that's STI, not just prevention, but treatment. And you can basically copy paste the uh, same overall thesis of there's the burden in the US, there's the burden in the state, and then Harris County that you see in yellow here is obviously got a higher burden than both of those. So once again, this is rate, controls for, obviously we have a lot of people, but this controls for that aspect of it. We just have a higher burden of chlamydia. You'll see next, same thing, gonorrhea, and this is primary and secondary syphilis. With these numbers, Texas tends to be anywhere between like 19th and 23rd ranked in the nation for STIs. When you look a little further, we're actually 5th for congenital syphilis. And that's one of the things that led us to, gosh, it's been over 2 years now, or almost 2 years now, that we've been focused on the syphilis outbreak. And what it was, we not only realized there was an increase in syphilis numbers overall, but specifically with folks of childbearing capacity. And that's really where we focused our work to intervene in that vertical transmission. And so that shows the work that we need to do. Now I'm going to do just a quick overview of what we do to intervene and how we go about that. So we've got a lot of collaborative services, not just with the partners that you're about to hear from, and not only within our department, but within our bureau specifically. So kind of the between bureau partnerships that you'll see, we partner with our clinics, our health centers, and they offer services, everything from immunizations to family planning to TB diagnosis to dental care, and then more relevant to our realm, STI testing and care, HIV testing, and PrEP prevention as well. We also partner with an amazing communications team here. They help us out with larger messaging and marketing campaigns to reach the public. And then within our mighty bureau, we've got a small but mighty provider outreach team that does not only general education for providers, but they also reach out on kind of a case-by-case basis when they see missed opportunities or places that maybe they can help organizations perfect on best practices. We also have a training and capacity building team, and they not only help out within our bureau, but within the larger department and community as well. They even help run one of our community planning groups, our HIV community planning group, that's responsible for informing a lot of our HIV work. We have the policy and evaluation team, which I'm kind of partial to because I happen to be on that one. And we are the in-house data geeks. And what we basically try to do is advise on policy from the organizational level all the way up to the federal level. And then some of our unsung heroes, we do have a dedicated surveillance and data science team. Um, these folks not only help inform our disease intervention specialist work that you're going to hear a little bit more about, but they're also the ones that look to inform our effort, and we try to communicate that. We were using something called our heat maps during the syphilis outbreak to inform our community partners where the burden of transmission was the highest, which just kind of helps us. Obviously, we're in public health. We all work with limited resources. We want to make sure we're getting the most impact from the deployment of those resources. We have the finance and contracts team, which keeps the money flowing or the work doesn't get done. And the biggest unsung heroes of all, and maybe that's because I was admin in my previous life, but nothing would get done without the support of our admin team. And so that's what happens within the confines of the health department. But then we also have community and collaborative planning. I mentioned the ending the HIV epidemic. We did, with the grant funding we received from that, one of the big objectives was to come up with that thing you see there. It's called the master plan, because we did that in partnership with some of the Ryan White folks you're going to hear from shortly. And also, huge shout out to the community members that helped inform this, because if it's not informed by the community, it's not going to be successful. That's one thing we know and we live and preach. And similarly, so the master plan was done in 2022. Just last year, we launched our hepatitis elimination plan. Very similar format and similar developmental structure. These links are going to be live, so when I share these slides, you'll have a quick hyperlink to both of those. But how we show up in the community, you're most often going to see us in this capacity, and that's our community outreach team. And so they're not just doing standing community events, anywhere from popular nightclubs, neighborhood gathering spots, but they also do events by request and data-driven response. So I mentioned our surveillance team. This is one of the things they help inform. Again, we want to make sure we're getting our services where they're needed most. And so that's, we look to their data to help inform our deployment of resources. And then the other big piece, and I'm going to get into, I could do an entire presentation on this next part alone. In fact, I did last month. And so I'm not going to do their work justice in just a few slides, but the backbone of our work and the folks that are on the front line of disease transmission intervention are our DIS, or our disease intervention specialists. These folks are tasked with not just a complex, but a very time-intensive workload of trying to track down folks that are essentially that have been diagnosed with HIV or STI, and that's either through one of our community-based subrecipients testing and referring, or through that surveillance team that I mentioned monitoring lab reports. But they're reaching out to folks that probably think they have a lot better things to do than talk to a government official, and they're trying to solicit very intimate personal information from these folks, such as what partners have you been with, so they can reach out to those people, get ahead of the transmission. Again, this is anonymously, but get those people tested and those people into care if need be. And so we've got some specialty DIS teams for kind of high impact, high volume providers, the jail, and emergency departments that are doing routine screening. And I included that little flow chart visual there to kind of give you an idea of the workflow they do. But there's some catch-alls. So I mentioned they can do the contract tracing and partner elicitation and notification. The client also has the opportunity to do that as well, but there is kind of a fail-safe to make sure that we are getting those folks and getting them into the treatment that they need and deserve. And then similarly, and I'm glossing over the finer details here, but we have a non-medical management team. We keep our DIS very busy with their aspect of their work. And you're going to hear another piece of this later, but like I said, we work with community partners. Us at the city health department are only funded for prevention and service linkage. So we're not in the HIV care realm. So we have a dedicated team that if we are testing and diagnosing individuals with HIV, these guys are the folks that make sure that to the public, it looks like we are all the same provider. The public doesn't know the difference between county health department and city health department, nor do we expect them to, but they deserve to have the appearance of a seamlessly flawless service delivery. So these folks reach out, make sure that the folks that are testing positive have access to care. If there are other barriers to that, they are working with ancillary services to make sure that we're meeting those needs, and everyone that deserves the care can get that. And so often this is what the community members' first contact with us may look like. When I tell you the folks that do these roles, especially disease intervention specialists, that it takes a very special individual. They have to have a unique combination of not just persistence and dedication, but compassion and Sherlock Holmes level detective skills to successfully do the work that they do. And so my heart goes out to these guys. They do it because they believe in the work. It is not easy work, and they have a almost insurmountable task of trying to develop relationships with people and earn their trust in very little time. And they do it wonderfully, and my hats go off to them. But again, soliciting very personal information up to and including things like qualifying eligibility information to make sure that we're getting them to the services that they can utilize. Not going to go too much into this, but wanted just to include any reporting for providers out there that had questions about it. So there's links to various, whether you're in our Harris County or surrounding counties. For the most part, the reporting window is 7 days for acute HIV or primary secondary syphilis. That is 1 working day with a follow-up within that week. A few related policies just as a reference. And quickly before I turn it over, just want to say, I always include this because it's important to me, but we fall under state and federal policies around confidentiality and security. And then here at the health department, we know how precious this information is. We take it another step further. One of my favorite examples is we're supposed to have files locked behind two locked devices. I'll tell you, I have to scan in 4 different times, pass a security desk and an administrative desk before I can even get to the room where the files are locked up. So we take our job there very seriously. Another convoluted slide that I'm not going to ask you to digest, but just to give you a visual, these are our different funding streams. The Houston Health Department falls under a couple of them here. I mentioned we've got STI, STD funding. We've got funding, or over here rather, funding for HIV prevention. Some of our other partners you're going to hear from fall under the community-based programs from HIVSTI and the Ryan White funding, A and B. The reason I include this slide is to illustrate this is the burden we have to overcome to make sure that we are delivering seamless services. And it's why I wanted to have this conversation. It's why I wanted you to hear from our partners. And that's why I also want to make sure that we're enrolling everyone we can to make sure that these aren't barriers to our community members accessing the whole health care that they need. And with that, I'm going to hush for a little bit and I'm going to turn it over to two incredible individuals that I actually just recently got to meet. And that is because they are brand spanking new to their role, although they both come with a lethal combination of experience. And that is Rashon and Amber. The floor is all yours.
Thank you, Elliot. Good afternoon, everyone. I'm Rashon Ohafia. I am the new director for the Ryan White Office of Support here at Harris County. And so today we just want to give you all a little bit of an overview about the Planning Council's duties and how we fit into this larger HIV landscape here in Houston, Harris County area. Next slide. Thank you. So just to give a little bit of an overview about the funding structure for the Ryan White Planning Council and any CARE dollars that come into our system. Currently, Congress, initially back in the 90s, delegated funds for Ryan White, specifically to ensure that individuals had access to HIV medications and any services that they needed to improve their quality of life during the epidemic. As we can see from this diagram, the money passes from Congress to HIVSTI and then to the CEO, which in this case is the county judge's office here in our EMA or eligible metropolitan area. And then the funding goes down to Harris County Public Health and Ryan White Planning Council, which is housed within the county judge's office. Below, you'll see that not only at the Planning Council do we have our Planning Council members, which is consistent of 30 to 40 individuals, and then also down to the standing committees. And we have the Ryan White Grant Administration, who is our administrative agent responsible for administering the grant out to the subrecipients. Next slide. So a little bit about the Planning Council. This is a group that is based off of volunteers that are tasked with improving the quality of life for people living with HIV or affected by HIV. And also they are the main leadership arm of planning and allocating funds for HIV services within our area. A little bit about our mission and vision. Our mission is to improve quality of life and advocate for those living with HIV and or affected by HIV, not only through leadership and planning, but also resource assessment and allocations. Our vision is to create an educated, compassionate community where all HIV affected individuals receive accessible, effective, and culturally responsive services as part of a coordinated system. Excellent. A little bit about the Ryan White HIV/AIDS program. It consists of 5 parts: Part A, Part B, C, D, and F. What we're focusing on here is Part A in our area, as we talk about the Planning Council, is that is the responsibility to ensure state funds. And then also the Planning Council provides input for our Part B and state services, which focuses on our rural and still affected communities across the board. And then in 2024, the funding that the Planning Council was able to appropriate was approximately $31 million across both of those grants. And my last slide, council structure. So like I was saying, it's about 35 to 40 volunteers that are appointed by the county judge every 2 years. They do serve a 2-year term. They do have, they base all of their council structure and implementation off of Robert's Rules of Order. And then this does include community members, service providers, and consumers. And when we talk about community members, we're not only talking about folks living with HIV, but we're also talking about their family members, their providers, their social workers, whatever the case may be as far as those structures. And with that, I'll pass it off to Amber, our health planner.
Next slide, please. Good afternoon, everyone. My name is Amber Barrow, and I'm the newest health planner for the Ryan White Office of Support. So some of our council responsibilities, they have several key responsibilities, and they start by assessing the needs of the local HIV community through needs assessments and reviewing local, state, and national epidemiological data. We then use that information to prioritize which services are the most needed and allocate those funds accordingly. Every April, we host our How to Best Meet the Needs sessions to help shape those allocations. And the council is also responsible for recommending standards of care and working closely with those local stakeholders to develop a comprehensive HIV service plan. We've also partnered with the Houston Health Department to create an integrated plan for both prevention and care in our area. Next slide, please. So in addition to planning, the council stays active in the community. One of the signature tools that is created with the assistance of the council is the Blue Book, which helps clients understand and navigate available services to the community. They also provide just support at local health events and host Blue Book Jeopardy sessions to make sure that learning and resources are engaging and interactive for the community so that not only they have the resource, but they understand how to use it effectively. Next slide, please. So the administrative agent for our program is Harris County Public Health Ryan White Grant Administration. They hold the administrative mechanisms to develop requests for proposals and all contracts for care dollars in our eligible metropolitan area, our EMA. And their role is to ensure that the services, which are based on the council's recommendation, are actually delivered to people living with HIV across the Houston EMA. Next slide, please. This is just our contact information. Any of the data reports, needs assessments, Blue Books that we do publish are available on our website, and you can reach us through our office phones as well as our individual emails. Thank you for your time.
Thank you all both so very much. And I mentioned I just recently met Rashon and Amber, and it was in the same breath that I also said, and oh, by the way, would you like to come present to a group of total strangers about the jobs you just took? So they were very, very generous to say yes to that, and I very much appreciate it. I can't wait to see what you guys do in your new roles. With that, our next partner, and I got a little bait and switch for you guys. So Jason Black is not going to be here today, but he has assured me we are in great hands with someone I know I'm going to be new best friends with, and that's Mr. Eric James from the Ryan White Grant Administration. Eric, the floor is yours, sir.
Thank you. Good afternoon, everyone. Elliot, thank you for inviting me to participate today. So my name is Eric James. I am the Assistant Program Manager with Ryan White Grant Administration, who does administer the Ryan White funds in the Houston EMA. And if you want to go to the next slide, I'll let you drive, Elliot. So as Rashon mentioned, we do receive the majority of the funds for the Houston area and the surrounding area. So we receive about $27 million annually for Ryan White Part A funds and the Minority AIDS Initiative, which is shortened to MAI. Those funds we receive directly from HIVSTI via Harris County Public Health, and Ryan White Grant Administration does act as the administrative agent. In addition, starting in 2020, we've received Ending the HIV Epidemic funds, about $4 million every year. Unlike the Houston Health Department, our side of that is the treatment side. And so again, receive those funds directly from HIVSTI, administered, delivered to Harris County Public Health, and then we administer those funds. A little bit more about Ending the HIV Epidemic. We currently fund 6 different agencies or subrecipients for our EHE services. And if you want to go to the next slide. These are the activities that we currently fund under EHE. The bulk and the main focus of EHE would be the Rapid Start. That is the initial visit with a provider post-diagnosis of HIV, and then getting that prescription written and filled within 72 hours is the goal. We do provide funding for rideshare services. to help individuals get to those medical appointments, pick up those prescriptions. And then since then, we've also focused more on quality of life pillar, which we've added here in Harris County. So we've done some rental assistance funding for about 6 months worth of rental assistance. We do some outreach engagement activities. We've included outreach campaign dollars to try to make the program a bit more widely available or widely understood. And we've also included some dollars just recently for mental health psychiatry services, as well as some health insurance assistance programs. How is the eligibility requirements for any of the HIV epidemic is very simple. Proof of HIV diagnosis. That's all you need to qualify for EHE funds. EHE funding is utilized by individuals who are newly diagnosed within the past 12 months. We also focus on those who have fallen out of care and now returning to care, which means they've not received any HIV-related services in the past 12 months. So the idea would be to get those individuals back on their antiretrovirals as quickly as possible as well. This one must. So just talk a little bit more about the Rapid Start model. Again, that is the primary focus of our EHE funds, and that's getting the individual connected with a primary care physician. So newly diagnosed individuals or return to care individuals, get them that prescription for their ART, and then get that. The goal is to get it filled within 72 hours and to get them started on medication within 72 hours. We do fill the prescription for 30 days under EHE, and we've also recently added funding for non-medical case management service linkage to help link them into care, link them into Part A care once they're ready for that. And part of that would include a brief assessment so they can assess all the services that a client may need once they are transitioned into Part A. And let's talk about Part A. So we currently have 9 funded agencies for our Part A dollars, including the Houston Health Department. Oops, did we skip one? Yeah, so for EHE eligibility, you go one more, please. Part A eligibility is a bit more. Obviously, we need the proof of HIV diagnosis, but we also have proof of residency and proof of income requirements under Part A. Client needs to be living within the Houston EMA, which is Harris, Fort Bend, Chambers, Liberty, Montgomery, and Waller. There's federal poverty level limits for most services. Most of them stand at 300% or 400% of the FDL. And then, of course, they should be uninsured or underinsured. A big part with the Ryan White is it should be the payer of last resort. So if there is any other funding stream, that should be utilized before Ryan White funds are used to pay for these services. As far as services under Part A, we do fund outpatient ambulatory, so their primary care visits with their doctors, some psychiatry, as well as nutritional assessments. We do have a local pharmacy assistance program that we fund, as well as EFA, emergency financial assistance, mostly for prescriptions to get them started or to carry them before they get moved on to ADAP. We do have oral health care that we fund. And the next slide. For case management, we do medical case management, service linkage, and clinical case management to help with mental health. We do have health insurance and cost sharing assistance, medical nutritional therapy. We do substance use care, outpatient counseling, and we do have medical transportation that we do fund to help clients get to their appointments. And we do have 2 new support services that we've started funding this year. The Planning Council allocated additional funds for 2 more service categories that are just starting this year. Home delivered meals for individuals who need some assistance, typically diagnosed with some sort of secondary comorbidity like diabetes, may need some help with their meals. And then transitional assisted living to help individuals who have been released from a medical facility, but may not be able to quite go home on their own yet. So we're excited to roll those out this year and see how they go. I want to talk a little bit about how Ryan White Part A intertwines with our EHE grant. So we often talk about Ryan White as one large house, right? So HRSA owns the house, but Ryan White Grant Administration acts as the landlord for the house. Our 9 Ryan White subrecipients, they rent rooms from the house and within the house and provide the services. So you can think of each room as a service category. The kitchen might be outpatient ambulatory, living room might be health insurance. Um, so clients enter the house typically first through the foyer, through the entranceway, and that would be EHE. So EHE is their entrance into the house, entrance into Ryan White Care. And then once they've completed that service and we can connect them into the larger Ryan White Part A care, they have access to the rest of the house. So all the health insurance assistance, medical case management, um, nutritional assistance, all that would be done at the rest of the house once they make their way in. And that's just kind of an easy way that we've come up with to kind of describe how we intertwine the Part A and the EHE grant. And I believe the next slide will discuss how we coordinate with the city. So for EHE, the 4 pillars of EHE are, prevent, diagnose, treat, and respond. So the city, of course, does a lot with prevention. Work to reduce HIV transmission. Obviously PrEP, community education, risk reduction, and then on our end, we, get everyone hopefully taking antiretroviral therapy in order to get them to that uh, undetectable level, as Elliot mentioned, U equals U, right? Undetectable equals untransmittable. Diagnose, again, the county has very little to do on the diagnosis side. We typically, just kind of support the linkage into care once they are diagnosed, and the city of Houston really is tasked with HIV testing in Houston and the surrounding area. Treating, obviously, we have a good partnership with the city as far as linking newly diagnosed individuals into care. And then once we link them into care, Ryan White will cover those services, the rapid start visit, and then further ongoing Ryan White care with all the other services we provide. And then the respond, addressing potential HIV outbreaks with targeted prevention testing. We would collaborate with prevention teams to ensure treatment access once those individuals are identified, through an outbreak investigation or other data means. And just real quick, just to let you know, this is, I believe, actually all Ryan White services. In calendar year 2024, we served over 16,000 unduplicated clients. That included 3,720 new clients. And again, new for us means newly diagnosed or new to care, which means they've not received care in the past 12 months. And that did come out to over 170,000 client visits. And if you have any questions for me, that is my information. Always happy to answer questions.
Eric, thank you so very much, especially for jumping in last minute on this. I greatly appreciate it. So next, and give me just a second to switch over here. I want to introduce someone that if she ever runs for president, I will be submitting my application for chief of staff. And that is the illustrious Shatara Johnson, as I fumble her name, sorry. Shatara does amazing things with a group it's the resource group. She leads that charge in our area, but she's also um, a, a leader of so many other wonderful initiatives, the Texas Black Women's Initiative being one that comes off the top of my head. And with that, Miss Shatara, I'll drive.
All right.
And the floor is yours.
So, since you're my chief of staff, keep your finger on the trigger because I'm gonna go through these slides pretty quickly because you, Eric, or Rashawn or Amber kind of hit some of the federal high points as it relates to Ryan White Care Services. And so I'm gonna kind of speed through that part. So You won't have to hear that twice. So go ahead. So this is just some jargon, and you can look at this. I try not to use jargon or use the abbreviations, and when I'm doing trainings and things of that nature, but it does slip up. I've been doing this for 12 years, so I do tend to be like AA, and people be like, "What is an AA?" It's an administrative agency. So this is just a list of some jargon that you may see or hear in the presentation. So the resource group is the only community-based HIV/AIDS agency in the state of Texas that is a administrative agency. All other administrative agencies, like Eric's office, Rashawn's office, even Elliot's office, the city health department, are all in a governmental entity. And we are the only administrative agency in the state of Texas that is a nonprofit community-based organization that administers probably about $10 to $15 million of Ryan White funding and HOPWA funding for 51 counties in Texas. So we do not only just serve the Houston HSDA, we serve the Texarkana HSDA, Tyler HSDA, Lufkin HSDA, Beaumont HSDA, and Galveston HSDA, which encompass 51 counties and a third of the state. And so you can just imagine, and that's over 6 grants. So you can just imagine our office of 12 and us doing all of this work, and I'm a department of 1 as the planner. So all of the things that Amber and Rashawn do with the Ryan White Planning Council in the rural areas, I do that solely alone. But it's all good. It all works out. Next slide. Just of course, just background on Ryan White. It was an actual child, an individual, that this federal funding was legislation was named after of. So we're very I like to put him in the slide so to humanize HIV because it is a human disease, and anyone, any age, any color, whatever, can be dealing with HIV and living with HIV, and can contract HIV. So I like to humanize, keep the human in HIV and not just the disease part. Next slide. And the purpose of Ryan White is to provide services like Eric said, in regards to HIV care specifically. And so in that, the goal is to reduce inpatient costs with HIV related issues. The goal is to provide services to people, again, who are underinsured or no insurance at all. So it is that community safety net for this public health issue. Next slide. So you kind of got a feel of what the landscape is. Again, the U.S. DHHS has the Congress basically say this is how much the HIV Bureau is going to get. Then they send it over to HIVSTI, and then within HIVSTI, there's an office called HAB, the HIV/AIDS Bureau. Next slide. Then we get to the good part. You know, we love these diagrams, right? And so I couldn't imagine your diagram that you just showed. I was like, what? Whoa, okay. But for us, this is how it's outlined as it relates to the grants that we administer within our 51 county area. So again, you got HRSA. You have 2 divisions in HRSA. In HRSA, you have the Division of Services Systems, and then you have the Division of Community-Based Programs. So for everything that's in yellow, that's what the Ryan White, that's what TRG provides in our 51 counties. So state services is a funding stream that state funds. It's not HRSA funds, but it is the allocation and the funding and the policies around the state funding still aligns with the Ryan White funding, federal funding. Then we also have our HUD HOPWA rural funding. So this is given to us from the Texas Department of State Health Services to us to administer to our local service agencies. Again, we have Part B. Part B do not get $27 million like Part A, but we do get a substantial amount of funding, and it is focused on those rural areas or territories, in state territories, where there is less population of HIV prevalence, but there's still HIV prevalence. And so in that and in this discussion, I always, one of the things I love to uplift is rural HIV matters, because a lot of times when we, especially in this forum, we only think about the big cities. We only think about Houston. We don't think about Beaumont. We don't think about Galveston, who share some of the similar. So their numbers are almost identical, just on a smaller capacity as it relates to Houston. We don't think about Nacogdoches and all of these other areas when the majority of the state of Texas is rural. We have 5 big cities who get Part A, but the rest of the state is rural, and so we are the ones who cover that funding. We also receive Part C funding. We write our Part C funding for our rural areas to increase their funding capacity in their areas. Some people write their Part C for different populations and programs, but ours is specifically for our rural areas, so no Houston agencies get our Part C funding. Part D, on the other hand, that is for the WICI population, that is women, infants, children, and youth. This is funding that we provide to subrecipients to provide those services for that particular population. So entities like Texas Children, UT Health, UTMB in Galveston, who provide pregnancy services for pregnant moms, case management, linkage to care, all of that. That all falls under our Part D funding. Next slide. And these are just all of the funding service categories. They may not all be funded in the Houston area or surrounding areas, but these are the services that could be funded if the council says, hey, we see a need there, or if the planning groups in the rural areas say, oh, there's a need for this, we can look at that data to support opening up different service categories. But the biggest thing with Ryan White is prioritizing our services, because we only have this pot of money, that we have to take this pot of money and allocate it towards these different services, which I'm sure is on the same on the prevention side. So we have to ensure that we do those assessments, as Amber stated, and those needs assessments and things of that nature, so we can prioritize the services in the area, so that we can ensure that we are funding services that get used. Next slide. So we can go to the next slide. So this is just a quick overview. Again, Part B is for rural areas. Also, Part B includes ADAP. A lot of people don't know that, but Part B also includes the ADAP program. But the state, we don't handle the ADAP program. The THMP, which is the ADAP program for the state, Texas HIV medication program, I did say that acronym, that is the recipient of that ADAP funding through Part B. Next slide. And again, as I stated, a lot of people are like, what the heck is state services? State services is your tax dollars. So there is in the state's general funds for the Texas Department of State Health Services, there is a line item for HIV care services for state services. And so it's normally a smaller pot, a much significant smaller pot of money, but the money is a little bit more flexible sometimes as it relates to Ryan White, to where they can cover different things, expand on different services, and approve different services to be provided that maybe Ryan White may not be able to provide. Next slide. So this is just a visual of our area. And actually, after I get done with this town hall, I'm gonna go to Tyler, so yay. But this is a visual of our area. Again, the Houston HSDA HIV service delivery area consists of 10 counties, to include that 6-county area that the Ryan White Grant Administration at the county provides. In saying that, what we try to do is not duplicate services. So we work very closely with Eric's office and Rashawn's office, so that we don't duplicate services. And a lot of the services that we fund, Part A doesn't. And there's a couple of services that we both fund, but it may be for slightly different things, like oral health. We cover the majority of oral health services in Houston, but I think Eric's office cover the rural clinic of the rural area for oral health, or it might be vice versa. I can't remember, but we try not to duplicate services, so we try to work together to figure out what the need is and allocate funding appropriately. Next slide. Again, this is just a visual of the Houston HSDA. Go to the next slide. So these are the services that we fund in Houston through Ryan White Part B State Services, Ryan White D, and HOPWA. As you can see, it's less services, but very significant services. And so for Ryan White Part B, we primarily fund in the Houston HSDA oral health services, as well as health insurance assistance. Let's uplift health insurance assistance, because we want to try to get people on health insurance so that they can get this assistance, because this will help pay for premiums, co-pays, deductibles, all of that. Ryan White can help pay for. We know that when an individual is on insurance, they are able to not only take care of their HIV, they're able to take care of what other health issues they may have, diabetes, heart disease, whatever it may be. And Ryan White only takes care of that HIV portion, although Ryan White can pay for some medications for those other comorbidities, but it's better to have health insurance to cover all of those different things. So under state services, we fund health insurance assistance. So health insurance assistance is one of those services that's funded under each grant because health insurance costs so much. So yeah, mental health services, special populations, hospice, non-medical case management, and linguistic services. Some of our state specific, because we are a nonprofit AA or community-based AA, we tend to get thrown some of the state's wonderful ideas because we don't have so much governmental red tape. So a lot of their grand ideas, or even with the ADAP enrollment workers, that started at the resource group. That actually started as my brainchild of putting that whole concept together for Houston to help eliminate the ADAP application issues that they were having and delays in approvals. And now that's a model that they're using across the state. So we kind of, because of our status of not being in a governmental agency, we tend to get thrown into special projects from DSHS, like the ADAP enrollment workers, food bank, medical transportation, and emergency financial assistance. Those are actually food bank and medical transportation was specifically for our bridge reentry program, which is under our HOPWA grant that was assisting individuals that was coming out of TDCJ and Harris County Jail to get them housing, food, and transportation to and from their health appointments and things of that nature. And then we also have emergency financial assistance, compassionate care. They are an entity that provides medication to clients. Under our Ryan White Part D funding, you can see here the services that we fund under Ryan White Part D. Remember, that's for the WICI population only, women, infants, children, and youth. And then for HOPWA, we provide services under those different areas in HOPWA as it relates to housing services. Also, we try to reduce duplication of services, because Houston HUD, I have to get the right name, Houston Housing Department, Houston Housing also receives HOPWA, and they receive the actual larger amount of HOPWA funding for the Houston area specifically. So a lot of our HOPWA funding is specific for our rural counties, our rural areas. Next slide. And just there's just a little difference between Part A and Part B. Of course, Part A get their guidance from HIVSTI directly. We get our guidance from HIVSTI, but we also have a middleman, which is the state. So we really, so our goal is to adhere and provide the guidance from the state when it relates to Ryan White Part B and state services funding in the 51 county area. Next slide. So, as much as we, there's rules for Ryan White Part B and rules for Ryan White Part A, and they may not always match, but our goal is to really ensure that we reduce as much administrative burden to our subrecipients, because a lot of the subrecipients that Part A fund, we fund as well. So that means monitoring tools are different. That means contracts are different, all of that. So we try to align as much as we can to have some kind of uniformity, so that it won't be so much administrative burden on the agencies trying to adhere to two different types of measurements and things of that nature as it relates to their contracts. Next slide. And we're going to zoom through. We can go to the next slide. This is just stating that the Ryan White Planning Council provide recommendations to the resource group to provide to the state on different services for the Houston area. That's what that last slide was stating. We've already kind of went through data. You can roll through the next couple. Keep going, keep going, keep going. Perfect, keep going. So these are the here you will find the number of individuals under our state services utilization who utilize the services in the Houston area. As you can see, under our state services for the grant year 23-24, the goal was 2520, but their year to date of unduplicated clients was 1,264 with those particular service categories under state services. You can go to the next slide. You can go to the next slide. That's just money talking about. Okay, and then for Ryan White B, it was 3,551 unduplicated clients who received health insurance assistance, premium assistance, as well as oral health care services. We do not provide home and community-based health services anymore, just because it wasn't a particular need. Not saying it wasn't important, but it wasn't a high priority service. So we don't provide that service anymore. Out of those two services, a little over 3,500 people were served under. So people got some good teeth cleaning and health insurance. Next slide. And then these are the individual, this is just a breakout service utilization slide of those who utilize health insurance assistance in the Houston area across all grants. So this is Part A, B, and state services. We've served a number of 30, in this particular grant year, that was a little over 37,000 unduplicated requests for health insurance assistance. There was almost $5 million spent. Excuse me, that's way more than 5 million, but it was quite a bit of money that was spent. 5 million that was spent on health insurance assistance in the Houston area that supports 3,700 individuals, unduplicated individuals. Next slide. Next slide. So again, as I stated, for our Part C grant, we primarily write our Part C grant for our rural areas to expand their services. Our rural areas, so for the Houston area, we receive about maybe $6-7 million for Houston for Ryan White Part B state services. Our rural areas receive a couple of $100,000. So it's a big difference from and that's because of prevalence, and that's because of people living with HIV and all of that. It's all based on this formula that the state comes up with to provide the allocation. But because there's less prevalence, there's less allocation in those rural areas. So our goal as the AA for our Beaumonts and Galvestons and Tylers and Texarkanas is to expand their services through Ryan White Part C. Next slide. And again, no services is impacted or provided under Ryan White Part C for the Houston HSDA. Next slide. And that's the allocation for our Ryan White Part C. A little over $1 million in our last grant cycle in the services that we provide under Ryan White Part C. Go to the next slide. This is our One Cares for Another Positive Vibe project. This is the Part D project. The Part D project is special because it really looks at a family-centered approach as it relates to women and infants and children and youth, and not so much of a they try to look at it as a way to support everyone in the family and not just the individual. Because we know with pregnant moms and partners and families, we know that there's a different struggle than an individual individual adult may have. And so there's this special funding for this particular population. Go to the next slide. So again, it promotes participation in clinical trials, case management, transportation for services, all of those different things for this particular population. Next slide, please. This is the funding that we receive for Ryan White Part D and the services provided under Ryan White Part D. So uh, in so you see on the chart it says 534,000, but that's service allocation. The other part is administration, those administrative slides and things of that nature. But overall, we receive almost $1 million in Ryan White Part D for pregnant moms. What's unique to this particular funding stream is that most women, when they're pregnant, particularly in our population, they get on Medicaid during the pregnancy. And so you a lot of times you won't see a lot of money allocated to outpatient ambulatory health services. There is some funding for those that may not qualify for Medicaid or things of that nature, but because they get on Medicaid and then babies on Medicaid or children text can't think of the insurance for the kids, but Medicaid for the children. A lot of our allocations under Part D is under support services like case management, health education. Chip, thank you, Phil. Outreach services, a referral for healthcare and things of that nature. So those really tight support services, especially case management, that's one of the biggest services allocated under Part D because it is truly a warm handoff, warm case management with this particular population because we want to ensure that baby, mom, youth, particularly are getting the services that they need to take care of their HIV status. Next slide. And just quickly, HOPWA, we do provide HOPWA in the Houston area as well as throughout the other 51 counties. But specifically for our Houston area, we to ensure unduplicated clients and duplication of services, we specifically provide our Houston areas. They have to provide the HOPWA services with specific counties. Because Houston Housing has HOPWA as well. So for Houston, our funding, our HOPWA funding is primarily for being Warden in Colorado counties that Houston HUD does not cover, as well as Galveston to included in the Houston funding allocation for Matagorda County because Houston Housing HOPWA also provides HOPWA funding for Galveston County, and they in their service area, Galveston County and Brazoria County is a part of their service area, but Matagorda County isn't. So to fill that gap, we use our HOPWA funding for the agency in Galveston to provide the HOPWA services to individuals in Matagorda County specifically. I know that's a lot, but that's how that works. Next slide. These are the and so this is the allocation for HOPWA services is little over $650,000. Compared to Houston HOPWA, that is a drop in the bucket. I think Houston HOPWA will get probably about the $30 million or something like that for housing. And so this funding here is for the entire 51 counties that the resource group provides that we subrecipient with. So there, of course, the allocations for the Houston area is quite smaller. This is for Houston, and this also includes the Bridge Reentry Program, where we house individuals immediately post incarceration from TDCJ or Harris County Jail into a motel, hotel situation temporarily, and then into a permanent housing situation, an apartment room or a one bedroom apartment, if they have income to help subs. It's a lot of eligibility stuff around there, but we try to house that particular population under that program. So the majority of the funding that the Houston HSDA receives is for that specific program, and about 100,000, I would say, is specifically around traditional hospital services. Next slide. And if you have any questions, you're feel free to reach out to me. We are no longer in the Montrose area. For those old heads that's on the call that know about us, we was on 500 Levette Street in Montrose. We are now off of Buffalo Speedway, right at the intersection of 59 and Buffalo Speedway. Thank you so much. I think I went over, but I'm sorry.
You're fine. Thank you. And when I was first trying to talk, thank you to every one of our presenters so far. When I was first trying to talk Shatara and Jason Black into entertaining my crazy idea, I told the both of them, I have yet to hear y'all speak and not learn something. So every time y'all present, I learn something new. Okay. And Rashon and Amber, I already know that to be true, even though we just met. I have one bonus update. We have Kirsten Short that heads up our epidemiology department with a quick Mpox and measles update. You may have heard of that. And then we're going to open it up to a group discussion. I know there's some questions in the chat, which I'm going to address. But the quick one is, yes, slides will go out to everybody, so don't worry. Funding slides included. Kirsten, the floor is yours.
Hey, thanks, Elliot. I feel a little bad going after all of these wonderful people who had so much knowledge. And I really have to echo this, although I've worked, in the HIV world or at a minimum HIV adjacent world for the last 20 plus years. I learn something new every time I come on and hang out with you guys. So thank you for that. As Elliot said, I just want to do a couple quick updates. My name's Kirsten Short. I'm the Chief of Epidemiology for the Houston Health Department. So we do have HIV surveillance kind of under our umbrella, but what I'm going to talk about today is sort of my everything else surveillance, right? So we have HIV surveillance on one side, kind of everything else that's considered reportable conditions, according to the Texas Administrative Code. And I'm going to talk about two things specifically real quick. So the first is Mpox. You may have seen me come on before to talk about Mpox. It is still out there, and that's really kind of the message that I want to get out. Between February and roughly now-ish, we've had, in 2025, we've had 11 cases of Mpox reported to us. We didn't have any cases in the first 5 weeks of the year. The cases that have come in recently have been primarily Hispanic or non-Hispanic white males, generally in that adult range, so between the ages of like 25 and 45, men who have sex with men. So nothing terribly surprising in that group or that awareness there. And they've been unvaccinated folks. One thing that has come up that's a little bit different than what we saw sort of at the height of the outbreak a couple of years ago is we've had several people come in who tested positive, but not really have any awareness of Mpox symptoms. So they came in because they had something that looked a little bit funky, but Mpox wasn't something that was on their radar. So just a couple of reminders is continue to keep it on your differential if you're a provider. Continue to educate your patients about Mpox and sort of those signs and symptoms, things to look out for, ways that you can prevent. As we know, right, vaccination is the best way to prevent Mpox. And if you do contract it, it'll give you a much milder presentation. And so try to keep that discussion about vaccination kind of as a routine part of your patient encounters. And then for my friends that are on here who are community partners and everybody else, you continue to have every opportunity be an opportunity for conversation. So whether it's asking your provider to have the conversation if they didn't initiate it, helping them build that into their kind of routine repertoire, and continuing to educate in your communities that the Mpox risk continues, and there are things that can be done out there. Evelio, I see in the chat vaccine locations or contact information. So generally, people can look up into our 832-393-4228 call center number. And that is a great resource to get linked in to looking for appointments on that side. And then the other thing I want to talk about, as I kind of changed my notes a little bit, would be measles real quickly. And so you guys, if you've opened, a newspaper or an online app or a news website, right? We've seen measles in the news. And so just a couple quick numbers, right? So as of April 11th, federally, we've had over 700 cases of measles reported just in 2025 by 25 different jurisdictions. Texas has the largest proportion of those. I would say about 70% of those are outbreak associated. It means about 30% of those are not outbreak associated. What that means generally is that you have somebody who's traveled overseas and returned back to the US and was exposed to measles while traveling, and then developed symptoms either on their way home sometimes or after they get home. And I really bring that up because it's, there's a lot of media talk about this West Texas outbreak, and it's fair. But there are also kind of these repeated introductions into the United States, into our population here. And so we also just need to be aware of that as well. Within Texas, we are up to, I think, about 541 cases. I think those are old numbers. I didn't update them on my notes. Apologies for that. Across 22 counties, 56 of those people have been hospitalized, so about 10%. That's not an insignificant amount. These are hospitalizations that could be prevented. And unfortunately, again, if you've paid attention to the news, we do have 2 children who died. They were previously healthy and unvaccinated children. And so I just, again, want to remind everybody, we have had non-outbreak cases here in our region. So we've had our 3 cases in Houston, 2 in January, 1 in March. There's a case recently diagnosed in Harris County outside of Houston, a case recently diagnosed in Fort Bend. And so our cases have been travel associated, not associated at this time with West Texas. But again, it's sort of the same message, right? Vaccination is the best method for prevention. And to the providers that are on here who are thinking, I'm not a peds provider, it's important to have those conversations as well with your adult clients. Some of these cases have been in adults. And not everybody remembers being vaccinated as a child, depending on where you grew up and the time that you grew up. So it's important to have those conversations as well and reference folks around. Thanks. Appreciate the opportunity to change the topic slightly.
Kirsten, thank you. And it's all related, right? And I snuck it in there. I dropped the number in there you mentioned, but I also snuck in there a invitation for a town hall tomorrow. It's got the Measles 101, and this one's actually geared towards community health workers. So please help us spread the word. It's this time tomorrow at noon tomorrow, and there will be, I think it's 1.5 hours of CEs. If anyone has limited access to the chat, I'm going to try to get notes out from today as quickly as possible and include that as well. With that, the last thing that I've got on my agenda is I just kind of wanted to open it up. We can open it up for questions, certainly. Also, I had a few questions for discussion in the wake of all those presentations. At first, I'm going to address, there was one up there, I think it was from Wally, about has any of the CDC restructure affected our funding? The short answer for you, and I'm trying to not let my my mouth get ahead of my brain here. It not yet where the HIV side of things are concerned, although it's one of those we are taking everything day by day. It's kind of a wait and see. There's a whole lot of uncertainty. I foresee there being more discussion on this at our next town hall when we have more questions than answers at this point. So when some of those start getting answered, I'm sure we'll be revisiting that discussion. And I've got some some other references and resources I can maybe share about where we are with all of that right now for those that are following the RIF and the restructure at the federal level. I did want to circle back. I know there was a question Avilio had about ADAP, specifically insurance navigation and enrollment. I think you had for Ms. Shatera. I'm not sure if we answered that.
So I did provide a couple of the link to the state TAP program. So the TAP program was launched this past open enrollment in 2024. It is through the THMP, or Texas HIV Medication ADAP program. Is to provide health insurance to individuals living with HIV. It's the same as the local, in a sense, it's the same as the local health insurance assistance, except it do not cover copays or deductibles or dental or vision. But it do cover medical procedures and things like regular insurance, and it also covers medications. So this is just another avenue for people living with HIV to get health insurance, and the state ADAP covers the premium and medication costs. Again, it's a better pathway for people living with HIV to have health insurance to take care of other things outside of just HIV. And it's a cost thing as well. It's cheaper to have them on insurance than to have them on Ryan White.
Well, and Shatera, I was in another meeting this morning, and so long as we are going to consider healthcare as a privilege instead of a right in our society, we're going to have our work cut out for us. So beautifully stated. We have a lot of work where that's concerned. So folks, I've got a few questions up here, namely from you guys. Are there other ideas or opportunities for collaboration within any of the jurisdictions we mentioned today? Every time you say 51 counties, my brain explodes a little bit. And are there any suggestions out there about how we can better communicate these services to the community, or engage the community in research efforts and share the results? So I throw those out there just as kind of idea starters, but at this point, the floor is open. Please, if you've got any questions,
Elliot, can I
let
just
us
say
know.
one thing about how we can help each other out? So on part A and part B, we all have RFPs for our services, different times or whatever, but I think it will be helpful to get the word out about the RFPs. I mean, we are, as an AA, we do have to put it in the paper and do all of those things, but who actually picks up a newspaper anymore? So a lot of times, trying to get the RFP announcements out is a bit of a challenge. But if we can all collectively, when we see a RFP come out, share it to your distribution list and all of those things, that will help open up new access points, or even increase capacity in services in the Houston area. So whenever y'all see an email from me and it's an RFP, please share it, because we don't know what agency will qualify to be able to apply for these fundings in our community. So I think that's a great avenue to help assist with trying to get the knowledge of the services in the funding out.
Well, and I think Stephen, on kind of that note and everything we've talked about, he's reminding us about the resource that is the Fast Track Cities members in Texas, and how can we leverage that support. That's another great network. And I'll tell y'all, a new hero or heroine of mine is Miss Sword, that's active in the chat. And I was almost going to forget to do this, but Stephanie is the executive director of a fabulous organization called Save Texas Moms that does very, very similar work. And we've been talking because again, all these things are related to me, right? Like I know we're the HIV, STI, hepatitis bureau, but all of this is related. And Chatera, I know I've mentioned this idea to you, but my idea for our next town hall is to really focus on maternal mortality and the disparities around that. And so stay tuned. Coming to a Teams invite near you. It'll probably be this summer, but we're looking at getting an effort around that. And y'all don't be shy. We still got a few more minutes, and let me see here. I'm gonna do one other thing.
Elliot,